Jim Joyce, happy Wednesday.
Hey.
We made it.
Happy Wednesday.
We made it another week. Your background looks a little different.
Yeah, this is the basement conference rooms of the Le Meridien Hotel in St. Louis, in downtown St. Louis.
Wow.
I'm doing a little bit of in-person customer calling, and there's a conference. You ever heard of BioSTL? You ever heard of Bio? This is a fantastic group. There's like
No.
there's a big conglomerate of like healthcare biotech companies, like big huge healthcare organizations based out of St. Louis. So they have this kind of BioSTL innovation conference. Major players here, Cigna, the 7Wire guys are here, and they've got 21 companies pitching away. So anyways, good to see you.
Those 7Wire guys, they're everywhere. I just saw, Alyssa and Garber and HLTH, right?
Yep.
It's great. It's great. I think Lee and Glenn are speaking at Startup Health in a few hours, but good stuff. So I'm back to Barcelona. Last week was amazing. A couple of days in Milano with Frontiers Health crew, Roberto and team. So that was fantastic to see a couple of hundred people, live in 3D again. So this keeps happening and happening.
I saw you on stage, on Twitter and with Jessica. So what was the big takeaways from Frontiers? What surprised?
Probably no major surprises, but I think Roberto actually did a great post, kind of summarizing some of this stuff. I'll maybe link it to the comments, but I think a couple of things like telehealth is really here to stay. Right now, it's just how do we look at telehealth, not versus virtual care, but kind of with and going deeper into the content. Shout out, there was a great discussion between Aptar and Voluntas, right? After the acquisition and kind of what's next, just some highlights. Of course, Glenn and I discussion was fantastic, probably one of the best on it.
Well trained.
I don't know. I just lots of discussions as far as just seeing people and kind of seeing what's happening on the ground. But speaking of happening on the ground and the front lines, I'm gonna let our guest in a minute because he also has some tight timelines. So we've been now that everybody's like traveling again or sort of like there's just it's different. Like we got to sort of start rushing through it, which is maybe okay. So I'm gonna let Corey Dion Lewis in.
Great name.
And as he is entering into our virtual bar room here.
Where's he calling from?
That's a very good question. We'll find out where Corey is calling in from. But Corey, before you start, I just want to give a little context how we met. And all roads seem to be leading when it comes to like YouTube podcast stuff to Dan Kendall. Dan kind of said, "Oh, you really need to meet Corey." I think Corey, you reached out or vice versa, and we'll talk about your podcast as well. But welcome to the shot.
Thank you. I'm excited. I've been watching you guys on YouTube for a while. I was just waiting my time.
Your time is here.
You think it comes true, right?
Yeah. Corey, nice to meet you. Jim.
It's nice to meet you as well.
Where are you calling from?
I'm in Des Moines, Iowa.
Ooh, very cool. That's our first Des Moines, Iowa.
Yeah,
that's right. That's right. So for as I like to say, for our millions of viewers and listeners, tell us who Corey is and your roadmap.
Yeah, so I'm just a 38-year-old kid trying to figure it out, man. Just clinical health coach. I've been in a clinical setting for the past it'll be 5 years in April. Been a health coach for the past 11 years, started in a corporate wellness setting. Got my degree in health coaching from the University of Iowa. But during my time in corporate wellness, I had the opportunity to get to be trained by Johns Hopkins in the science of weight loss and behavior change through a digital health platform that they had collaborated with the company I worked for, called the Energy Healthier Weight program. So we got trained on that, and it was just a great experience. I learned a whole lot about health coaching through a digital lens, which was really, really cool at the time when it wasn't like it is now. But yeah, and I'm just here trying to do the best I can to advocate for health coaching and just people in general.
So, I love your comment on 30-year-old kid, just trying to figure it out, because I always kind of say, like, I don't even know what I want to do when I grow up, kind of thing, right? I'm still trying to figure it all out constantly. So.
Yeah, well, it's like when I first connected with you, Eugene, it was like you even asked me, so like, what's this podcasting thing all about for you? And I was like, I don't know, I'm just having cool conversations with cool people. You know
right.
what I mean?
Yeah, exactly. And then you got a little following, and then it gets bigger, and then we go Joe Rogan style, right? So that's kind of.
I mean, I want to jump right in, like, so clinical health coaching, like, what is that?
So clinical, I work in.
Sorry, for once, Jim, you're not gonna hear health coaching from me. So from the front lines.
I'm sure there's a few plugs coming our way. Some subtle, some less than subtle.
Well, the less subtle one is that I just got done with my panel on human eye versus AI. We have a global health and well-being coaching symposium going on that Corey is also part of. So we suckered them in on all the channels here, including the shot.
Which was a great thing. It was awesome. Thank you for letting me be a part of that. But so here in Des Moines, I work for a federally qualified health center, so within the primary care clinic. So what I do here is whenever a patient sees their doctor and they meet certain, health criteria where they have a high BMI, or if they're hypertensive or pre-diabetic or type 2 diabetic, they refer them to me, the health coach. And what I do with them is a lot of which the cool thing is what I do is what a whole lot of other health coaches that are maybe in clinical settings, they don't do or aren't able to do, because when I took the job here, I had the benefit of them not knowing what a health coach did. Literally told me that in the interview, like, we don't know what health coaches do, and you do, so do that. So I was like, perfect. So I see patients on a weekly, bi-weekly basis where we start with behavior change. We go over behavior change strategies and tips, but also I've created a program where, if I have a patient for whatever, weight loss, diabetes, hypertension, there are steps that we go over to help them change their behaviors as far as what they know about, healthy eating habits. Health literacy in the population that I serve is really low. So I'm doing a lot of education on reading nutrition labels, and a lot of people who come to me who are diabetic and have no idea what that means. They just know they got a phone call from their nurse that said, hey, you have type 2 diabetes, your metformin's at the pharmacy, and they're like, okay, cool. Right. So
what does that actually mean? Right.
Yeah. So when I ask them, say, what do you know about your diabetes, they're like, absolutely nothing. So it's a lot of education, and then just kind of helping them along the way. And the benefit of that is that, a lot of these doctors, I think the average I read last was they see a patient average like 15 minutes, 10, 15 minutes is the average visit. Well, I see them no less than 30 minutes a session. So we're going over a lot and making sure before they leave my office that we have realistic goals that they can go into the week and learn from, and come back with some more questions and some more things that we can improve.
So Corey, maybe just and again, it's not you mentioned education, right? And of course, there's a sort of job description of a health educator, and I think combining health education, and I think there's a misunderstanding around what a health coach actually does. People kind of expect people to tell them what to do, as in many times the doctors are prescriptive in their sense. Where I think people are trying to put the lens on and trying to understand, well, why aren't you telling me what to actually do, right? And the job of a health coach, I mean, I don't have to tell you, it's like to not prescribe what to do, but actually help you reach and understand what that is. But
yeah, which is really the mindset in a clinical setting, right? When they come to see me, they want me to tell them what to do. And you said something there, Eugene, prescribing. As a health coach, if you prescribe anything, that is so far out your scope of practice.
Yep.
That is language I don't like. It makes me cringe. I don't prescribe anything. The role of a health coach, yes, I do give education, but it's how I get that education. So you need to know, or I need to know, what do you know first? And because this is your journey, I'm just here. I'm your coach. I'm here to lead you along the way. You know what I mean? And draw up the play if I need to, right? But I need to know what you know first, because once you leave my office, I can't hold your hand. So it's all about guiding them and helping them figure out, understand. They have to come up with the solution, and I'm just there kind of guided.
Do you you must I remember one time I had a chance, back when pharmaceutical industry used to be, had different practices, but we hired, this is years and years ago, we hired Butch Harmon, the famous golf coach, Tiger Woods golf coach, right? And he played 3 holes, with everyone. And then he watched you swing a golf club. And within 2 seconds, he just goes, here's what you're doing wrong. You know what I mean? 2 seconds. He looked at you with one swing of the club, and next thing you know, 20 yards more out of everyone's stroke, right? They're just kind of a savant. After coaching people in weight loss, does someone walk in the room and are you tempted to say, okay, 20-minute conversation, what they look like, what their records, and you're like, I know what's going on here. How do you deal with that?
Yeah, because you hear, especially doing it so long, you hear a lot of the same reasons.
Right.
I don't have a lot of time. I can just look at how their posture and just how they're talking to me, if they're really into it, or if they want to see a health coach, or if they think that, I've been trying to lose weight for 5 years. You can't do anything for me. And they're going over all the things they've done. I've heard it all. I've seen it all. You know what I mean? And just the hard thing though is not being since I heard it all, this is what you got to do.
Right.
Right. Because as we know, especially now with social determinants of health, I might hear people say the same things, but, Joe Schmo may live on a better side of town that has other access to other things. And this person who's saying the exact same thing may not have those access, may not have much access. So the solution is going to be different, even though they're saying the same, giving the same, reasons for why they can't change. So it's just having to take a step back and kind of put my bias to the side and just really just listen.
Let them go on. Yeah.
Yep.
And sorry, Eugene, jumping ahead of you here.
No. Listen, I talk health coaching all day long, so I let you, I'm just going to put myself on mute, go get a scotch or something. I don't know.
These GLP-1s, right? The GLP-1s that are out, right? They're coming out now, the Novo Nordisk product that have, this great data around, it's kind of biology plus health, plus good structured weight management. Is that coming into your practice yet? Or do you have a view on that?
I would love to see something like that right now. The only, technology that I use, which has been really beneficial, has been, trackers where I can see what my patient is tracking as far as their exercise and their food and their weight. So I can see that data. But, outside of that, everything's really in person and just, that personal,
maybe so I was thinking on the medicinal front side, like you said, hey, you go get your metformin.
Oh, yeah.
There's this new class of injectable medications that is just new, and they're coming out, and they seem to have a really, big impact. That if you do what you do plus these meds, I was wondering if that was kind of coming into your practice.
I haven't had that experience yet, but I'd be curious to see what that looks like in combination with having someone working on your behavior. That'd be interesting to see.
You're talking about, was it Calibrate, or is that the company name, or there's a few?
That's the name of a, that's the name of, I know you're familiar with, that's the name of a company that, has kind of brought in, medicine.
Yeah, one of now few.
Yeah. But I was just wondering if that, you as someone kind of fighting the fight every day, or podcasting, understanding about it, where is that is that starting to like seep into it, like, into the practice yet,
Right. Not here, but man, I would love to see it, just to see how it works and how people are able to, like I said, change their behaviors and how it can help, because it's all about improving the patient care, right? So I mean, if it's beneficial, I would love to see it.
Yeah. Awesome.
So, you're in a primary care setting, right?
Mm-hmm.
And, Marina and I talk about this all the time. It seems like much of a buzzword around health coaching. Everybody kind of uses, health coaching, health coaching, health coaching. And to your point earlier, when you talk to patients on the ground, many don't even understand what that is. You've been in primary care system. What's your, what do you answer, right? When people are like, well, what is a health coach? I'm just
Right.
curious.
So my answer is, typically, if someone asks me what a health coach is, I just say I'm here to help you change your behavior, because you can't I can't do it by yourself.
Yeah.
Not like you can't change your behavior,
No,
but
right.
I'm here to hold you accountable. I'm here to help you change that behavior. And a lot of people don't really get it until they experience it, right? Because when I started my first health coaching practice, Supreme Health, years ago, everybody thought I was a personal trainer. And it was like, no, I'm not a personal trainer, but I'm talking you through you learning what you need to do for yourself. And it was just like a foreign concept. Like, why would I talk about it with you? Why don't you just tell me? It's a go back to the, why don't you just tell me, give me the routine, give me the food journal or the meal plan, right? It's like, well, no, that's easy, because anybody can do that. But if that were the case, if that worked all the time, there would be no need for, behavior change or for health coaches. So health coaches are behavior change specialists. Right. We change the behavior.
Behavior change agents. And I actually remember having this discussion. So just rewinding back, Kendall introduced us. Next thing I know, I think this was my 2 week of Clubhouse madness. We started having health coaching
on Clubhouse.
rooms. Yeah, so we spent some time in Clubhouse, right?
Awesome.
And then we moved our relationship to LinkedIn messaging, I think, after that.
Right. A little more asynchronous.
Next thing you know, he's at our symposium,
awesome.
and on the shot. So, and then it was just great getting to know, and I think the passion, and this is actually what Marina and I are finding is, I again, kind of stereotypically, just there's this love for people, right? From kind of health coaching as a practice, as a profession, just
right.
Kind of the love is there, right? So.
Yeah, well, it's a helping profession. So you know what I mean. So like right there with social work or psychology or therapy, it's a helping profession. So in order to be, I wouldn't say to be successful, because you can be successful in anything if you know what to do, but like the real health coaches have the best success when their heart is really in wanting to help somebody.
Right. Yep. Right. If you know someone, like, it's one of these things, if someone cares about you, anyone like loneliness for people, having someone actually care, having someone actually accountable, not just jamming stuff at you, that seems to be your model, right?
Yeah, because 10 years ago, I was an awful health coach. I sucked, but I cared so much about making sure that the person that I was talking to was heard. Back then everything was telephonically. So I was a telephonic health coach, but 2008, 2009, it was all telephonic. So really making sure the person over the phone knew I was listening to them. I cared about what they were saying. I didn't know everything about, reflective listening or, motivational interviewing, all of that. Like technically I knew it, but I didn't have it down. Right. But the fact that they knew that I really cared really, really helped me go forward with what I'm doing.
I just want to do a little bit. You mentioned listening, right? And we just hosted a kind of demystifying health coaching session at Frontiers Health last week in Milan, where we had a couple of guests from our friends from Happify, from Kaya Health, so the health coaches. And Marina kind of said something. There's a power in silence, right? And actually, Sara from Kaya, who is their sort of the manager of coaching, said silence and listen are made up of the same letters, which I never actually realized. Right.
Ooh.
I thought that was kind of fascinating. I never thought of it that way. I was like, oh, wow. I had to actually double check that. But so just,
Yeah.
the power of
cool.
listening. Yeah.
Silent. Yeah, that's in the notes. Definitely. Silent and listen are the same letters. That's wild. That's wild.
Yeah.
Yeah. Cause I think I was in a tough contract negotiations the other day, and, I'm kind of a chatty guy, and I just stopped talking, I made a demand and stopped talking, and the whole room was like in shock because they've never heard me shut up. And that's a way of communicating, right? That's a way of communicating. It's like, I've made my point, just move on.
Which actually gets to say, because, if I want to, I can just mute you right now. Right. But in real life, you can't. Right. So.
But and what about, okay, so talk to us about like Eugene and I are fascinated with your podcast. So talk to like what's going on, how's it going, what's the name of the podcast?
What was the trigger, right? Because I think you probably listened to what our trigger was to it, but like maybe start all the way from the trigger.
Yeah, I wish I had a really, really cool Genesis story about my podcast.
Just make it up.
So the podcast was something I said for like 3 years straight would be a cool idea. It would be really cool to have a podcast.
Right.
And then at the beginning of the pandemic, like when it got real, like when it was like, I had a caseload of patients, and I get an email saying, hey, Corey, cancel your patients for the week, then cancel them for the month. And it was like, cancel them, and it will just we'll just let you know what's going on. And at that time, I wasn't seeing patients. I was given the responsibility of screening patients in the door. So the few patients that we did come to see doctors, I would screen and go ask them all the COVID questions and all that. And I had a lot of time to think about, okay, what are some of the things that I always kept saying that were cool or I wanted to do and I just never did because of insert excuse, because I just never did it. And the podcast is one of those things. Like I'm going to do this podcast. Like this is the time. So a friend of mine by the name of Matthew Moore, he's a health coach in New York. We were talking and I was kind of telling him about my ideas of starting the podcast. And he was like, hey, if you do, I'll be a guest. And I'm like, all right, dope. So I messaged him and said, hey, start my podcast. He's like, I can do this day. I can do whatever. It was May 4th. No, it was first week of May, because it went live May 4th. So I was like, we can do it this day. So we scheduled the time, we scheduled the day. I had no name, I had no mic, I had no idea how to do a podcast. But awesome. So I went on Facebook Marketplace and I bought a mic off of, I now think this mic was stolen, but I bought it fair and square off Facebook Marketplace.
Recycled, we like to call it recycled. This is sustainable.
I bought a mic. I YouTubed everything I can YouTube, you know what I mean, to figure out, what are some good resources to use.
And the opposite of your approach, Eugene. Yeah.
I got it all set up. The podcast was first called Smart Talk.
Ooh.
Smart Talk podcast for is like specific, measurable, attainable, and realistic and right on time health and wellness conversations.
Ooh.
Love it, right? Thank you.
Love it.
When I would tell people the name, they had no idea what I was talking about.
Okay.
And they would look at me crazy.
Well, if you have something to do with health coaching and goal setting, then you would know, right? But
but a lot of people thought I had a finance podcast.
Okay.
They're like, well, you're a health coach. And I'm like, yeah. They're like, why are you talking about money?
Right.
Like, I'm not. And I had to keep explaining. And I'm like, I'm done explaining. Like, this is stupid. So I got to change the name. And I knew I wanted project in the name because I wanted the podcast to be about talking about and designing solutions for preventative care, health and wellness things. So I wanted project to be in it, and healthy was just the next thing that kind of works. And I looked it up on every podcast site, and there was no podcast called The Healthy Project. So it kind of stuck, and people really, really enjoy it. It works.
That's awesome. So, what's it called?
The Healthy Project podcast.
I love it.
We'll add it. We'll add it to the notes, of course.
Yeah.
So go ahead.
No, please go.
I was just gonna say, we now have like 80 something episodes, Jim, right? Like it's insane. I don't know what you're up to now, but like I always get asked, as I see people now in 3D, who was like the coolest guest or whatever. And of course, I don't want to play favorites. And actually, I think every single guest is amazing. But I'm curious, kind of like if there are things that stood out, or like I've watched some of them, not all, I'll be frank. But just curious, like what have you learned? Maybe just some things through that journey, right?
And Corey's going to be the coolest guest, right? Corey's.
Of course.
I appreciate it. We got to record it. So like we know. So, when I first started podcasting, I was looking at all these really big podcasters and I'm like, I like their flow. I like how like they're just kind of talking and there's no flow there. It flows well. And it's just kind of there. So for the first while, I never prepared. I didn't have questions. I had a guest who was either, at the beginning, I interviewed nothing but health coaches. So, a primary care health coach, a sugar coach, a sugar addiction coach, all these were coaches. And I was like, well, you should know about your expertise. So let's just have a conversation about it.
Right.
And then I realized those conversations were really, really awkward and uncomfortable because I'm sitting here trying to think of the next question and then they're done talking. And I'm like, yeah, so.
We specialize in awkward and uncomfortable. Yeah.
So like, it wasn't until I interviewed Dr. John Whyte from WebMD to where I was like, I should probably prepare for this interview.
So it's funny. I literally just sent him a message to also connect and like to see if meticulously unproduced he would join us as well. So put in a good word. So I know we kind of had to shift things around because you're actually seeing patients coming in. Jim is at a conference. We have our symposium running, so I need to head over to I'm back and forth. Maybe Jim, I don't know. Like I have so many things that I want to still ask, but I know we're all kind of in a bit of a rush. You want to go with your famous questions or set up?
Sure, if you guys are up for it. If you're ready, Corey.
I'm ready or not. Here we
go. Okay, so we'll do a little mental mental exercise here. So imagine yourself so you're 38 now. So imagine yourself a 28-year-old executive that's trained in clinical health coaching, and you've come up with a digital health solution, and you want to start this company, and you've got funding. The multi-billionaire Eugene Borkovich has given you your first funding round, and
I guess I lost it all since then. Is that
and you're looking back at your younger self. What advice would you give that young entrepreneur about to embark on the journey?
Oh, what I would give that young entrepreneur, and it's funny, it's actually a quote that I just posted today. And what I would tell him is, you may have to fight a battle more than once to win it. So keep going. Just keep fighting.
Wow.
Powerful.
Wow. Amazing. Thank you very, very much. I did just get a text from someone, nothing related to this, but just wanted we never done this before, like a random shout out, and completely anonymous for somebody who is like 30K above in the air flying on the plane and wanted I said that I'm recording it. I know it has nothing to do with this conversation, but I thought it was kind of funny and we've never done it before. A shout out for somebody who is flying. So that's it. I don't know, nothing more. Happy Wednesday.
I love it.
Craziness.
Love it. But yeah, listen, I think your whole career, like like you may have to fight a fight more than once, right? Like, is that so? Yeah. So you're fighting it every day. Every time you meet these people that have obesity or health challenges, you're fighting it every day. So, well, fair shakes to you.
Awesome. Thank you so much, guys. I appreciate it.
Thanks, Corey.
We'll talk soon.
Yes. Take care.
Over and out.